28-day cycle is actually a myth. It's so strange that something which was so natural, something which was so easy, has become so difficult today. So much so that we have IVF centers at every nook and corner in all big cities. Women are losing their eggs at a very fast pace.
There's also a myth around it that once you've gone through an abortion, the body might find it difficult to conceive the second time.
No.
Is that true?
We've seen couples actually breaking down when the pregnancy test comes negative. That's when most of the fertility centers, they have counselors actually. पहले तो stress की वजह से नहीं हो रहा, फिर उसके बाद जब infertility का भी stress हो रहा है, तो everything is getting added up together. Postpartum depression is real. In olden times, they used to say it takes a village to bring up a baby. But today, there is no village. The poor woman is all alone. Every woman goes through a lot of ups and downs in their life. This is the time when she's trying to make her career. This is the time probably when she's got married, she's thinking about planning a pregnancy. So there's a lot of stress, a lot of cortisol. She's struggling. She might become pregnant in between. So there's pregnancy, there's breastfeeding. So there's so much happening all around that poor woman. And then we say, oh, you can't even lose weight.
Doctor, I would like to discuss the menopausal phase for a woman. If you are 35, either you're already menopausing or you are in a perimenopausal stage. Is that true?
I have seen the best part of my life after my menopause.
Welcome to The Vital Edit, the podcast series of HK Vitals. Today, we have a very famous gynecologist with us, Dr. Anjali Kumar. She's worked in the field for more than 35 years. Today, she runs a platform for women health called Maitri, which has more than 1 million followers on YouTube and Instagram. Welcome, Dr. Anjali.
Thank you, Neha, for inviting me and to talk about such an important topic today. Thank you.
So, Dr. Anjali, we will cover a lot of aspects related to women health today in our podcast. And we want to start with hormones and their impact on women health.
Okay.
We all know that the moment we are born as women, hormones are into the play and they continue to play till the time we actually die. So what is the role of hormones when it comes to women health, and how does this role change over the years as we grow old?
Okay. So let's first talk about what are hormones. Most of the people actually do not know what are hormones. They've heard this term. So hormones are very powerful chemicals which are released by endocrine glands in our body. Now, these are very powerful, which means that even in very small quantities, they can exert very powerful metabolic effects. So they are released from glands which are there in the brain, thyroid gland, then of course in women ovary, men testes, so and from there they enter the blood and then they go to various tissues and exert their influence. Now, like you rightly said, that women's body or the life cycle is completely influenced and actually governed by various hormones. As women, we go through various cycles of puberty, then pregnancy, then breastfeeding, then middle age and menopause and so on. And all this happens because of a complex interplay of hormones, which are estrogen, progesterone, of course, in small quantities, testosterone, cortisol, prolactin. And most of the people know about estrogen and progesterone. Now, these are the hormones which are released from the ovaries. So what are ovaries? On both the sides of the uterus, we have two ovaries. So cyclically, every month, the ovary produces, makes the follicles develop. And in that process, estrogen is released. Now, estrogen classically is described as the youth hormone, which means that it affects the skin, it affects the elasticity of the skin, the youthful appearance of the skin. It's good for hair. And medically, it's good for your bones. It is important to prevent osteoporosis. It is something which makes our heart also function well. That is why when women age, when they go into menopause, the bones, they tend to become weaker. This is known as medically osteoporosis. Post-menopause, they tend to have higher incidence of heart attacks because the estrogen tends to have a protective effect on the woman's heart as well. Then we have progesterone, which is very, very important for attaining the pregnancy. Then we have a hormone called prolactin, which is released from the brain, which is important for lactation. And now we have some, I would say, culprit hormones which are coming in between. So there is a hormone called cortisol. Now, today everyone is talking about cortisol and, stress and everything. So I feel as a woman and as a doctor who've been seeing women for so many years, it's becoming increasingly difficult for women day by day. The stress levels are rising because women are working, they are tackling multiple portfolios. It's not that somebody who's a good mom doesn't have to be a good CEO. Somebody who's a good CEO has to be a good mom as well. Now, this releases a lot of cortisol and imbalance of hormones. And actually, cortisol is a hormone which is released from glands called adrenal glands. It's a survival hormone. We need some stress in the body. That is why we'll get up in the morning, go to the office and work. In case there's no stress, we will not work. But when the stress goes out of hand, when the cortisol levels go out of hand, that's where it affects the homeostasis of the body. The metabolic functions go haywire. And that's why we have now the, onset of so many new age problems like PCOD, weight and infertility and so on. So, yes, the hormones are there which govern us, but it's important for women to understand this entire system so that they can govern and they can control themselves better.
So, doctor, if hormones play such an important role in the gynecological domain for the women, there's a lot of conversations about hormones playing on our gut and our brain axis as well. Is it that the hormones actually affect the gut health
Yes.
apart from just the stress?
Yes, actually, in olden times, people used to say कि आपकी सारी बीमारियां पेट से शुरू होती हैं. In our ancient Ayurveda also, people used to talk about that कि सारी बीमारी की जड़ आपका पेट है. And somewhere, we always used to say, oh, it's my gut feeling. So somehow, people wanted to say gut is something which is very important, but it's now in modern medical science, now we are understanding the exact impact of how the gut actually impacts the entire metabolism, entire hormonal system in the body. So there is something known as a gut, brain, and a hormone axis. Now, this is a bi-directional communication system. Bidirectional means it works both the ways. The gut can impact the brain can also impact the gut. So, just to let you know that gut has got 100 million neurons which line our intestine. And at every moment, they are sending important signals to our brain, to our hormones. It might become a little technical if I tell you how this happens, but it's important that to understand that what we eat, the entire microbiome, which is there in our gut, affects our hormones, affect our brain. Since we're talking about women and we are talking about hormones, there's a hormone called estrogen. So a part of the gut microbiome, which is known as estrobolome. So, Neha, you'll have to tell me if I'm going technical, somewhere, but I thought it is something very interesting for people who are watching this also to understand. So microbiome is basically the gut bacteria which are there in our gut. So a part of this gut bacteria is known as estrobolome, and this is important for the estrogen recycling. So what happens is, like I said, estrogen is released from our ovaries. From there, it goes to the liver for its metabolism. Then it is excreted in the bile. Then it comes to the intestine, where these bacteria, they sort of metabolize estrogen. And in case this is not right, it leads to estrogen dominance in the body, which means a lot of estrogen goes back into the bloodstream. And all those modern illnesses, PCOS, fibroids, endometriosis, fertility, can happen only because of altered microbiome. So, you might ask, how does the microbiome gets altered? Once again, the modern day lifestyles where we eat wrong things. There is no fiber, we don't exercise, we have exposure to processed, packaged food. So the poor bacteria inside, they can't survive. And hence the entire cascade of events happen which disturb the hormones. Another interesting thing is, you probably would have heard about serotonin. It's a happy hormone. Do you know 90% of serotonin is released from our gut? So in case our gut is not happy, we will not be happy. So that's how it's a very complex interplay of the brain. And of course, brain also keeps sending, signals. There's again a very interesting group of hormones called leptin and ghrelin. So ghrelin is a hunger hormone and leptin is a satiety hormone. The ghrelin is secreted from our gut. From the gut, the signal goes to the brain. So that's how, it's such a complex system. And it's very important that we understand this. Only then we will be able to do things which are good for ourselves.
Absolutely. Doctor, altered microbiome या फिर increase in estrogen, is this also behaving somewhere with the weight loss journey in women today?
100%, 100%. In case your, hormones are not in alignment, you will tend to gain weight at wrong places. We always talk about that women classically have what is known as a pear-shaped body, right? Men have, especially people who are obese, they tend to have an apple-shaped body, they're rounded hair. Why does that happen? Is because estrogen is something which actually helps the women to gain weight at the thighs and buttocks, which are somewhere in the evolutionary perspective, which are good for, us becoming pregnant. Now, in case we have a hormonal imbalance, women tend to gain weight in the central area. This is known as central obesity or truncal obesity. So, of course, hormonal imbalances are the reason which make a woman, sort of struggle more than the men to lose weight. And classically also, women are less muscular as compared to men. So we all know that muscles are something which consume more calories and they help in weight loss. So as women, we need to be very, very careful that we build up good muscle in the body by regular exercise.
Doctor, when it comes to the age, particularly for women, there is this saying that, the moment you turn 30, you're going to start aging very drastically. Is this true when it comes to our hormones, or is it true actually when it comes to science?
So my personal experience says that it's not like कि 25 पे कुछ हो जाता है या 30 पे कुछ हो जाता है and उसके बाद it's everything is downhill. No, it's not like that. Nowadays we talk about how if you look after yourself, you can have a very fruitful and a worthy existence even in the later part of your life. Yes, of course, aging is a reality. A lot of things, they change in our body. The First of all, it's not classically 25 or 30. I'm saying as a continuous thing, as we all age, especially in women, the estrogen levels come down. And so when estrogen levels come down, we tend to gain weight at the wrong places. The fertility declines. Women have problems with their periods, irregular periods, painful periods, heavy periods, higher chances of endometriosis, fibroids. And of course, as we age, the testosterone levels also come down. By the way, women also have a lot of testosterone in the body. So they become less muscular, they lose muscle. And it's a hard fact that after 30, everyone, men and women included both, we can lose 10% of our muscle mass in case we are not careful. It's called sarcopenia. So we need to work on maintaining that muscle, So, and of course, I feel another reason is the life changes. 25 and 30 is the time. Then every woman goes through a lot of ups and downs in their life. This is the time when she's trying to make her career. This is the time probably when she's got married, she's thinking about planning a pregnancy. So there's a lot of stress, a lot of cortisol. She's struggling. She might become pregnant in between. So there's pregnancy, there's breastfeeding. So there's so much happening all around that poor woman. And then we say, oh, you can't even lose weight.
Yeah. So, doctor, this section is about understanding PCOS and PCOD. पहले तो PCOS और PCOD में फ़र्क क्या है?
Okay. So PCOD is the modern gynecological epidemic. And why I say epidemic is something which is because it has assumed such big proportions that worldwide, I would say 1 in 3 to 5 women is suffering from some kind of manifestation of polycystic ovary. Then coming to PCO, PCOD or PCOS, ये सब चीज same.
Okay.
So everything is same. Polycystic ovary, polycystic ovarian disease, polycystic ovarian syndrome. Yes, this is like a syndrome. When it starts to affect a lot of other things also, we might call it polycystic ovarian syndrome. But for a normal person to understand, this is one and the same thing. So let's not say कि PCOD है, PCO है तो कम है, PCOD तो है ज़्यादा हो गया और PCOS और ज़्यादा हो गया. It's not like that. And another thing which I want to make my point is that it is the poor ovary which is showing the manifestation. Problem kahin aur hai uske andar. So the PCOS or the related symptoms like irregular periods, acne, hair growth on the face or on the body, hair fall, these are just these symptoms of a bigger issue inside. Now, that issue is what is known as insulin resistance. So, what is insulin? Insulin is actually a hormone which is released from a gland called pancreas in the body. Now, this is important for the glucose uptake in the body. So, when you eat a meal or when you drink something, your blood sugar goes up. But that blood sugar now needs to enter the cell. Only then it will be able to do its job. So the insulin is a hormone which opens the lock in a cell for the sugar to enter in that cell. So it is important for the glucose uptake. But what happens when the cell is already very full with fatty things and everything? The cell says, no, I don't want more sugar. So it keeps the gate closed. So the sugar is now not able to enter the cell. Now the pancreas produces even more insulin कि शायद अब ग्लूकोज थोड़ा अंदर एंटर हो जाएगा, लेकिन वो तो गेट बंद है, वो अंदर जाता नहीं है. So now in the bargain, the insulin levels, they go up. So now what happens is the blood levels of the insulin go high up, but the insulin is not able to work. So this is what is known as insulin resistance, that insulin is now not able to work. And there is a lot of high levels of insulin which are circulating in our body. Now, this high level of insulin somehow stimulates the ovary to form multiple follicles there. That's why on the ultrasound, we see an ovary which is studded with tiny, tiny, tiny follicles. Now, these follicles produce abnormal hormones, and most of these are male pattern hormones. These are known as androgens. And that's how you get hair fall, acne, hair on the all wrong places in the body. So the initial problem was insulin resistance, which led to all this. And now we say that insulin resistance is the reason for type 2 diabetes, hypertension, dyslipidemia, and lot of other problems. And we are only blaming the poor ovary. But the problem was something else. So, if we need to correct the polycystic ovary, we need to correct the insulin resistance. How would that happen? Is by once again simply eating a good diet, exercising, making sure that the body has less stress levels, the cortisol levels are less, and that's how this overall thing improves. And of course, there are a lot of medicines also in case somebody's having heavy bleeding or she's having trouble while conceiving a pregnancy or she has a lot of acne. Of course, a lot of medicines can be given to help the woman. But then all these medicines will work only to treat the symptoms of PCOS. Unless and until we treat the root cause of PCOS, which is the insulin resistance, we will not completely cure a woman from PCOS.
When it comes to PCOS, is there a certain age where you feel that, largely this is the age when I start seeing cases coming in? Could be young age or whatever that age is. And while I understand what you're saying is that lifestyle is the root cause for PCOS, but is there anything beyond lifestyle, like a genetics also, which causes insulin resistance? Just want to understand that better.
Yes. So, talking about the first question, what age it starts to affect? So, we have seen girls as young as 12 or 13 years having PCOS. In my experience as a doctor, I've seen the story of PCOS for all the girls typically start when she is in class 9th or 10th. When she's sitting in front of the computer, just studying and studying and studying, not really going out to play. So there's no physical activity, when there's a lot of stress. The mother is giving all the goodies to the daughter to eat so that she can study well. And that's when the first time things they start to go wrong. So
And
that's
what are the
why.
kind of symptoms that they come with to you?
So the symptoms are irregular periods, missing periods, scanty periods. Today half of my OPD is full with the patients who say that they no longer get as good periods as they used to get earlier. कि पहले पीरियड 5 दिन आता था, अब खाली 3 दिन आता है या 2 दिन आता है या खाली 1 ही दिन आता है. So scanty periods is one of the manifestations of PCOS. Of course, it can cause heavy periods also. Then, of course, a lot of acne and a lot of abnormal hair growth. So we need to understand, men tend to have hair on the chin and rest of the body, and they tend to have lesser hair on the scalp. So when a woman has a lot of androgens in her body, now she follows the male hair pattern, which means now she will have less hair on the scalp and more hair on the face and rest of the body. So acne and abnormal hair pattern on the body is a sign of androgen dominance in the body. Then, of course, she is not ovulating because the hormonal balance is absolutely haywire. So she might get trouble conceiving a baby. Most of the women with PCOS, they find it very difficult to lose weight. They may have weight gain. And later on, in case this goes untreated, it can cause type 2 diabetes, hypertension, dyslipidemia, which means abnormal lipid profile. It can lead to even endometrial cancers. So it's not that simple. Even though it's a lifestyle problem, you cannot say, oh, it's just a lifestyle disease. This is something which can have very important repercussions later in life.
Since this is led by lifestyle primarily, can this also be reversed by lifestyle changes? And the second part to the question is that once the bug has bitten you, even if you reverse it, do you have higher chances of getting the PCOS back?
Okay. So you asked one question earlier, that is it genetic or not? So some people have a genetic tendency to have insulin resistance and PCOD or something. But today is the time when we are talking about epigenetics,
Hmm.
not genetics.
Hmm.
Epigenetics is the effect of the environment
Hmm.
on your body. Today, we know for sure by so many scientific discoveries that you can actually turn on the good genes in your body and you can turn off the bad genes by modifying the environment. And once again, that emphasizes the importance of eating right, reducing the stress levels, and making sure that you move your body a lot.
Hmm. So can this be reversed?
Reversed. Okay. So coming to that question, when people ask me, can it be reversed? My answer to this is absolutely yes. And I'm saying this on camera. People say, no, it cannot be reversed. I strongly disagree. It's like supposing somebody is overweight. What should be the answer of that question? Can that person lose weight and remain thin forever? Yes, of course. If you take care of your diet, you exercise, you do all the right things, you will lose weight. And if you maintain all this, you will continue to be thin. But today, if you start eating bad food, you don't exercise, you obviously become fat. So if you do all the wrong things, your PCOS, your diabetes, your hypertension, everything will come back again. So why are we only saying about PCOS? The diabetes also can come back, the hypertension also can come back. Every lifestyle problem can come back in case you don't take care. It's as simple as that.
Endometriosis की बात करते हैं तो this is another thing which the term is being used very commonly now. People are becoming more aware of endometriosis, largely when they have more periods than usual, heavier periods, more painful periods is when they kind of come to the doctors and understand that they have endometriosis. What is this condition, and why is it said that once you reach a conceivable stage of your life or when you become pregnant, endometriosis reduces in the body? Is this
Okay.
a fad or,
So let's first understand what is endometriosis. So endometriosis is a condition where the endometrium, what is endometrium? It's the lining of the uterus, which lines the inner cavity of the uterus. It tends to grow outside the uterus also. The most common site being the ovaries and all around the uterus, so in the pelvis. So the way the lining inside the uterus becomes thick and bleeds at the end of the cycle, the lining which is present on the surface of the ovaries also thickens under the influence of hormones and it bleeds at the end of the cycle. Now, the bleeding which is happening in the uterus can come out. There's a passage for that blood to come out. While the bleeding which is happening on the surface of the ovaries cannot come out. So, every month, cycle by cycle, the blood tends to accumulate on the surface of the ovaries. Since there is blood there which cannot come out, the periods tend to be very painful because there is blood which is not able to come out. Since there is blood, it leads to a lot of inflammation. When there's a lot of inflammation, there's a lot of scarring. So the uterus and the ovaries, they tend to get jumbled. The ovaries get stuck to each other on the back of the uterus. The tubal anatomy gets distorted. The intestines, they tend to get stuck. So this is known as frozen pelvis, where the entire anatomy inside becomes absolutely jumbled up. So this leads to painful periods, this leads to heavy periods, this leads to difficulty in conceiving because obviously in case your tubes get blocked, in case the tubes get kinked, the person will not be able to conceive. Now coming to this question, why is endometriosis becoming more common today? Why are we talking about this? And as a doctor, also as a gynecologist who've been into this field for more than 35 years now, we've seen that the endometriosis patients are rising. Probably we are diagnosing more also now. We have good modalities today like ultrasound, MRI, and of course laparoscopy to diagnose this. But yes, of course, endometriosis is rising. Now, there are various reasons, and if somebody wants to Google, they can find out about what causes endometriosis. One of the theories is that the period blood tends to go backward. It's called retrograde flow of the period blood onto the surface of the ovaries. Now, in earlier times, people used to conceive very early. So when they used to conceive early, there was absence of period, 9 months, then breastfeeding time, so 1 or 2 years. So that retrograde flow of that period blood into the abdomen on the surface of the ovaries was not there. So one of the reasons is later age of pregnancies, lesser number of pregnancies, and nowadays we have a lot of immunological reasons also for this. High estrogenic diets, estrogenic dominance. We just now spoke about how your gut microbiome affects the estrogen levels or the estrogen metabolism in the body. So whenever you have a high estrogenic state in the body, uh, endometriosis is a disease which is influenced by the estrogen. Estrogen nahi hoga to endometrium develop nahi hoga. That's how in pregnancy, of course, there's a different reason. You have high levels of estrogen, high levels of progesterone, but the bleeding happens when all these levels come down. That's what happens in a normal cycle. So we were talking about the causes of endometriosis. One is, of course, the lesser number of pregnancies, the delayed onset of pregnancies, a lot of stress, estrogenic dominance. So, and of course, we are picking up more cases of
So you just touched
endometriosis.
based upon higher estrogenic diets.
Yeah.
And of course, we've talked about diets and lifestyle, right? Uh, what are higher estrogenic diets? What does a higher estrogenic diet look like?
I
And
would
what is that
say,
something that one should really avoid in everyday course of life as well, starting our teens, and just be careful.
so my answer here is we should learn to eat the way nature wanted us to eat.
Okay.
When we were hunter gatherers, what did the human being do when they were hungry? They used to pluck off, an apple or a fruit from the tree, or maybe, pluck a vegetable and eat. But today, we are surrounded by so-called good food. That good food is actually not a good food. It's actually a bad food. So making it very simple, anything which is ultra processed, refined, packaged, remember, is always doing good to the company who's making it, not you. So learn to eat food which is coming straight from nature. Learn to eat food which is, great, good in fiber. There should be plenty of fiber. Now, fiber is something which is a prebiotic for our gut bacteria, for our gut microbiome. And today we discussed how a healthy microbiome actually can affect the hormonal imbalance in the body. So simple, natural food, let's not mess around with the food much. And there should be good amount of fiber. And, unfortunately, I really feel today as human beings, we are eating much more than what we need. On top of that, we eat bad food. On top of that, we cook it in a wrong manner. On top of that, we eat it at a wrong timing. So that entire philosophy around food should be something which is important for sustenance of life. And somehow we have forgotten to differentiate between hunger and temptation. That's what is the crux of the problem.
So, doctor, in continuation to what we've been talking about endometriosis, let's discuss periods. Now, when periods today are coming to girls much earlier than the earlier times, why is it so that the menstruation cycle is starting as earlier as less than 10 years of age?
Yeah, that's a hard reality today. Today, we see young girls as young as 8 years having periods. Now, this is very difficult situation because she does not have that emotional maturity to understand what's going on with her body. And it's very difficult for a parent also to explain her the consequences of having a period now. Once again, this happens because of early maturation of what is known as hypothalamic pituitary ovarian axis. This is known as HPO axis. So let's talk about what is HPO axis. So HPO axis basically means hypothalamic pituitary ovarian axis. So we have a master gland called hypothalamus in the brain, which produces certain hormones. Now, those hormones work on the pituitary gland. Now, pituitary produces certain hormones which then act on the ovary. Now, the ovary produces certain hormones which finally act on the uterus to cause periods. So, somehow, this maturation of this entire axis from this to this for some children nowadays is happening very early. And once again, we know the reason is a bad diet, sedentary lifestyle, and lack of sleep. Now, this is something which is very, very important. Today, people are not sleeping. Now, this is leading to high levels of cortisol in the body, low levels of melatonin, which once again disturbs the entire hormonal milieu inside. So, it's very, very important for all the mothers who are watching this to just make sure that your daughters are physically active, they are fed the right kind of food, and they must sleep well. As a society, we are to be blamed for this. I mean, today children are exposed to a lot of screen time, and so there is so much which is happening around young children, which is causing all this. Then, coming to, like you said, what is a normal period? Like, how does a person know that my period is abnormal? Kab hum isko bolenge that now is the time that I must seek a medical help. So, first of all, that 28-day cycle is actually a myth. There is nothing called as a perfect 28-day cycle. A normal period could vary anything between 22 to 35 days. But in case your period earlier was 22 and now happening at 35 or 40, now that's abnormal. Or earlier it was happening at 35 and now it's coming every 15 days, that's abnormal. Then a woman can bleed anything between 2 to 7 days. That's also normal. But in case your period earlier was for maybe 5 or 6 days and now it's coming every just for a day or 2 days, then that's abnormal. Ideally, the periods should not be really painful. 1 or 2 tablets you might need to take during a period, but in case you need to take a painkiller all 5 days of your period, it is a sign of some serious gynecological issue like endometriosis, like some fibroids. That's when you must actually consult a doctor. We spoke about endometriosis some time back. We spoke about what causes endometriosis and how can you prevent it. But once the endometriosis happens, now you need a proper tailored medical protocol to make sure that this situation does not become worse. So it's very, very important for everyone who's watching this is that in case your daughter or you are having painful periods, it's very, very important that you must visit a proper gynecologist. And also, there should be no bleeding in between 2 periods, which means once you've stopped your periods and before the next period comes, there should be no bleeding in between. There should be no bleeding after the menopause. There should be no bleeding after the intercourse. So this is what is a normal period.
So, doctor, this section we discuss fertility, we discuss pregnancy, we discuss abortions, and we discuss miscarriages. Today, the incidences of infertility are really rising.
Yeah.
A lot of people around us in our vicinity, especially in the urban areas, are going to infertility clinics today. So, why is it so that women are going through infertility issues?
Yeah, it's so strange that something which was so natural, something which was so easy, has become so difficult today. So much so that we have IVF centers at every nook and corner in all big cities. That means the problem is real. So they say, according to WHO, the incidence of infertility is actually 17%. Which is quite high, which means 1 in 5 couples would probably face some issue in getting pregnant. So now let's also first understand, when do we say that it is infertility? What is infertility? ऐसा नहीं कि आपने 1 महीना ट्राई किया नहीं हुआ and then you say, oh, I must run to the doctor now. So, according to all medical guidelines, they say that in case a couple has been trying for 1 year without using any kind of a contraception and still not, manage to get pregnant, this is called as infertility, and then they must visit a doctor earlier. But there's a slight twist to this. In case you are more than 35 and you've been trying for 6 months, then please visit a doctor. So as the age goes up, of course, the chances of problems, they increase. So don't wait for 1 year. Then coming to, why is the infertility rising? So infertility has basically two equal partners in crime, men and women both. So it is said that 40% of the times it is a male factor. 40% male factor. 40% is the female factor. 10% is combined, like both, there's a problem at both the level, and 10% is cause not found. It's called idiopathic infertility, which means in 10% of the cases, we are not really able to figure out what's going wrong, probably stress and other things. And we've seen in so many cases, I mean, today, in modern society, stress is supposed to be a very big factor for infertility. And unfortunately, we have no way by which we can measure the stress. There is no quantifiable way to measure the stress. So, coming to men, what could be a problem at their level? Of course, the big parameter which we study is their semen parameters. So sometimes the semen count, the sperm count may be less, the sperms are not able to move forward. There could be problem in the morphology of the sperms, some hormonal imbalances also. But this also probably it is because of modern day lifestyles, exposure to alcohol, smoking, pollution, a lot of pesticides, herbicides in our life that causes, male infertility. And women, there could be multiple levels at which the problems could arise. Sometimes the ovaries are not ovulating, like in PCOS, irregular periods. Women don't ovulate, regularly. So when obviously agar egg ही नहीं तो pregnancy कैसे होगी? When the hormonal atmosphere is not good, now even the fertilized egg does not find the right place to implant, right environment to grow. Sometimes there could be a problem in the tubes, like we spoke about endometriosis. In case your tubes are blocked or kinked, obviously the sperm and the egg will not be able to meet. In case somebody has huge fibroids in the uterus, the entire anatomy inside the uterus is distorted. So the basic thing which I would want to convey to people is that in case you're not conceiving within 1 year and within 6 months, in case you're more than 35, it's very, very important that you get yourself investigated. And once we find the cause, then the right kind of treatment can be instituted for this.
So, doctor, which is very insightful, is that as much important is a woman's health to be fertile is a male's health. So almost like a 40% is what you've said.
Yeah.
But largely males would tend to ignore their health, and it's largely the women which is, the
More
center
than
point.
that, they don't come forward to get themselves investigated. I mean, ask any gynecologist. They would tell you, when we give them a prescription, the women come back with all the tests done, and the men would not get a simple semen analysis done. Or most of the times, their moms would come and say, "No, no, no, मेरे बेटे में कोई problem नहीं है." So it's a hard fact, but then people need to understand that you need a good sperm and a good egg and the right atmosphere inside for the good things to happen.
Yeah. Doctor, again, for fertility today, women are far more aware and they're getting into freezing their eggs in time,
Yeah.
which is, of course, new to the country. But, there are more and more women who know now that, it's important to also freeze the eggs when the egg quality is good. So, what is this egg quality? Why is freezing of eggs a wise decision? At what age should women go for it? Or when should women go for it?
So, before that, let's understand a hard fact. that women are losing their eggs at a very fast pace. I mean, I recently had a patient. She was just 33 years old. She was the CEO of a big company. She comes to me very happy that she has missed her period. We did a pregnancy test. It was negative. We did all the investigations and she was already in menopause. She started crying there and she says, Abhi to I've just settled in my career and now I was thinking about getting pregnant. So this is a hard reality. Women are losing their eggs faster. Women are going into menopause much earlier than what we used to see 10 or 20 years back. And once again, it is exposure to bad lifestyle. A lot of stress, a lot of worry, pollution, herbicides, pesticides. So, probably, all this is leading to loss of eggs. So, since we are dealing with the problem where women are losing eggs faster, it makes a logical sense to freeze your eggs for a later use. Now, we cannot tell a person that you get pregnant at 20 or 22 or whatever. Of course, medically, that is the age where the chances of pregnancy are the best because evolutionarily or biologically, that's the best age to become pregnant. But today, the society is such that women have a lot more to achieve, before they think of pregnancy, which is absolutely right. So, but by that time, in case your ovarian reserve has come down, then what do you do? So that's where egg freezing comes in. So today we have a option, a medical procedure by which you can actually freeze your eggs. And it's a very simple procedure. We give certain medicines to stimulate the ovary to produce more number of eggs. We monitor that on the ultrasound. And when we find that the eggs have reached proper a stage of maturity, we can suck those out and we can immediately freeze them. When to do the egg freezing? The earlier the better. So if you are, let's say, 25 and you still think, no, I don't want to get pregnant before 35, it makes sense to get your eggs frozen at 25 because at that age, we are likely to get better number of follicles, better quality of the eggs rather than waiting till 32 or 34 where the egg reserve already would have come down. And finding out your egg reserve these days is very easy. There are a lot of tests available, simple blood tests available, simple ultrasounds by which we can find out that how much is the ovarian reserve for a woman.
Okay. And there are OTC tests available?
Ideally, no test should be OTC. Yes, that's very true.
Okay.
No test should be OTC. I mean, unless and until somebody just wants to waste money like this, it's important. Come to a doctor. The doctor, more than getting your AMH or ultrasound, would tell you probably many more things which should
Yeah.
be tested.
Yeah.
And as a doctor, we would never tell, okay, go to this lab, get this whole package done. We
Yeah.
would tell you specific number of
Yeah.
or specific type of tests. You will actually end up paying lesser amount of money.
Absolutely. So, doctor, when the body is preparing for pregnancy, are there any supplements that you typically tell a woman to take, or
Yes.
in general life cycle of a woman's health from menstruation to a menopause? What kind of supplements that you want your patients to include?
So, just the supplement is actually not the integrated approach. Nowadays, we talk about what is known as a preconception counseling, wherein you must come to a doctor so that the doctor can understand your cycle, can tell you these are the days when you should be trying for your pregnancy. The doctor can take your detailed medical history in case you are on you're a smoker or maybe you take a lot of alcohol. The doctor would suggest you that you should be off all this. The doctor would tell you to lose weight, would go on to your medical history to change your medications so that you are suited for the pregnancy better. Then comes the role of supplements. So it's important to get yourself investigated and supplement whatever is deficient. There are certain supplements which are recommended by WHO. Most important is folic acid. Now, folic acid is something which is important for prevention of neural tube defects. These are birth defects. So every pregnant woman must be taking about 400 micrograms of folic acid, and Nowadays, we say it is a methylated form of folic acid. So that should be taken. Then, of course, vitamin D is very important. Vitamin D is something which is important for controlling a lot of metabolic functions in the body. Of course, calcium, magnesium, for men, zinc, selenium, of course, omegas. These are things which are good to do. Get your CBC tested so that we know that your hemoglobin is good, your iron levels are good, your ferritin levels are good. In case your levels are lesser, you must take an iron supplement, but not randomly. In case, let's say your thyroid levels are not good, you must get that sorted out first. So it's not that simple. Okay, I need to take a TTC supplement. So TTC is trying to conceive. TTC. It's a very common internet lingo which people use.
Okay.
But I really feel it's important to get the entire picture together and take the supplements what your doctor suggests you.
So, doctor, we talked about fertility and how people today prepare for fertility. There's also on the other side of things miscarriages, which is of course unfortunate, but a lot of times we see women going through miscarriages. How common is it in terms of seeing those miscarriages, and how do you ensure that the body is healthy after a miscarriage for the next conception?
So you would be surprised, Neha. The incidence of miscarriages is actually 30%. 30%. Just think of it. कि 100 में से 30 pregnancies are rejected by nature. Probably because they are not fit enough to continue into a healthy pregnancy. Out of all this, 80 to 90% of the pregnancy losses, they happen in the first trimester. Many times, even before a woman comes to know that she is pregnant. In villages, what happens is woman has a period which is probably 45 days or 60 days, and she just has a heavy period. She doesn't even come to know that she was pregnant. Today, in modern cities, people go to a doctor, get the beta HCG done, get an ultrasound done. So we come to know that there was a pregnancy loss. So in case we take into account all the diagnosed and undiagnosed pregnancies together, the incidence of miscarriages could be as high as 30%. And I want to tell this to all the women. Most of the times, rather practically all the time, a woman is not at fault. So please don't think that I've done something wrong or I have not done something which led to this. In 90 to 95% cases, the cause of miscarriage is a chromosomal or a genetic abnormality in the baby. And the nature decides that this pregnancy is not fit enough to continue further ahead because the nature can see what I as a doctor and you a patient cannot see. So nature takes a call कि ये pregnancy आगे चलने लायक नहीं है. Of course, there are many other reasons also: uncontrolled thyroid, uncontrolled diabetes, some infections, some abnormalities like fibroids. That's why I said it is important for a patient or a couple to visit a doctor so that all these conditions can be optimized before a woman plans a pregnancy. कि आपका थायराइड ठीक होना चाहिए, आपका शुगर ठीक होना चाहिए, आपका बीपी ठीक होना चाहिए, आपके अल्ट्रासाउंड में फाइब्रॉइड नहीं है, सब कुछ ठीक है. And then you start taking supplements and try on the days which your doctor has suggested. And how to make sure that abortion के बाद आप ठीक हो? By the time your process is complete, abortion process is complete, whether it was a spontaneous, expulsion of the pregnancy or if the doctor had to clean up. Most of the times we do all the tests and make sure that things are fine. And I would say you can just give a gap of 2 to 3 months and then start trying again. Most of the time is basically required for the emotional recovery of a couple.
So we also see women going through abortions. For whatever reason, they would come for an abortion. There's also a myth around it that once you've gone through an abortion, the body might find it difficult to conceive the second time.
No.
Is that true?
No, this is not true. Like I said, after 2 or 3 months of an abortion, or whenever you think that you're physically and mentally ready to plan a pregnancy, after your doctor has cleared you, you definitely can plan, and in all probability, your next pregnancy is going to be normal. It's in extremely rare situations. There are some situations, there's something known as thrombophilia or an Apla syndrome, where the blood tends to clot more uh, easily. Now, those are the situations where repeatedly a woman may have an abortion, unless and until that situation is not diagnosed or not treated properly. But by and large, after one abortion, there is no reason why a woman should not be able to have a healthy pregnancy.
So, doctor, I have two more questions to this one section, um, and something that I have observed a lot with women around me, or maybe younger to me, my age, is that ideally when you're getting pregnant, or you want to be pregnant, you want to be happy, you want to be healthy. It should
Yeah.
be a joyful process.
Yeah.
But we end up timing it and putting a timeline to it so much so that it really becomes a stressful process.
Yes.
So while there are external factors of stress, let's say our jobs or other things that are any which ways playing on our head, this becomes a big factor.
Yeah.
Towards, I also feel, infertility. So how do you go about suggesting women to actually just take this as a process and not put a very hard timeline to it?
Yeah, it's a sad fact that women or the couples, it's not just the women, men also face the emotional issues. I've seen men crying in my OPD when the pregnancy test comes negative. So the stress is real, coming to a doctor, getting your ultrasounds done, getting your test done, trying in a what do I say, not so natural manner, in a robotic way, when the doctor or the app is telling you to try, and then waiting for the D-Day and doing a pregnancy test. It takes a lot of stress. And we've seen couples actually breaking down when the pregnancy test comes negative. That's why in most of the fertility centers, they have counselors actually whose job is to actually counsel the people. So it can be a difficult journey for many couples. But people need to understand that first is the stress of infertility, and then the stress of the things not happening the right way, and the stress itself being a reason of the infertility. पहले तो stress की वजह से नहीं हो रहा, फिर उसके बाद जब infertility का भी stress हो रहा है, तो everything is getting added up together. And people need to understand that today we have such amazing technologies that we can actually make, by and large, 99% of the women pregnant, maybe even more than that. Today, the technology is such. So please do not put undue pressure on yourself, and please don't, put I always tell my patients से कि ऊपर तलवार नहीं लटका के रखनी है. ठीक है, इस साइकिल नहीं हुआ तो अगली साइकिल हो जाएगा, कोई बात नहीं. It's not like a life-threatening disease. Nobody is going to die because of infertility. So, you must make sure that you are there for each other. This is a time when both the parents, men and women, both, they need a shoulder to cry on or whatever. So it's very important for a couple to be holding each other's hand and be emotionally there for each other.
The second question, again, with people around me, if they are pregnant, see, when I go back to talking to my mother, she would say 40 years back, नेहा टेस्ट ही नहीं होते थे इतने. एक अल्ट्रासाउंड होता था या 2 अल्ट्रासाउंड होते थे, और that was it. Today, almost every quarter, there are maybe 1 or more ultrasounds that happen, more tests that are happening. There's a reason to it, right? And there's a good side to it as well.
Yeah.
But when we end up reading the reports, when we end up Googling a lot, when we end up using the AI a lot, we also end up interpreting more than we understand.
Yeah.
So that also leads to stress. How do we
100%.
make the pregnancy, apart from, of course, the effects of pregnancy on the body and the mind and the hormones, a smoother process when it comes to the women's mind?
So we need to understand that pregnancy is a very natural process, and by nature, it's a very robust process. I mean, अगर ऐसे ही किसी का abortion हो जाता तो सदियों से लोग बच्चे नहीं पैदा हो सकते थे, right? Somehow we need to trust that process well. And of course, in case there's a problem, we need to trust and surrender the doctor, whichever doctor we are going to, that the doctor would take care. And do not Google beyond your own capability. You need to understand that you will not be able to understand it the way a specialist would be able to make you understand. So, ठीक है, today we are in the age of internet, Google and AI. Google, as much as it makes you feel sorted or empowered, but from the moment it starts giving you stress, close the system and come to the doctor.
So, doctor, there's a stress to conception. There's a stress in the pregnancy, added stress. And then there is a postpartum, which a lot of women today so postpartum is just a phase of life. You've given birth, right? Uh, you are overwhelmed by the new responsibility. Your body's going through changes. Uh, but there's again a lot of stress added to the postpartum phase, and that's what we call the postpartum depression. Again, the incidences of this are far more in the urban cities today. What is it that you'd want to kind of give a message to the new mothers or about to be new mothers in terms of how to take care of their mental health, while, of course, taking care of their physical health as well in the next 3 to 5 months post the delivery happens?
Yeah. So, like you said, there is stress before conception, then there is stress in the pregnancy. But ideally, in the scheme of God, there shouldn't have been any stress. Most of the stress is created by us only, because we put a timeline कि नहीं इतने में तो मुझे pregnant होना ही है. And of course, in case you're struggling with infertility, there is stress. And in pregnancy also, ideally, most of the pregnancies are uncomplicated. And I tell this to people, bhai, enjoy your pregnancy. This time is not going to come back. Today, probably people have 1 or 2 babies and usme bhi hum itna हैरान परेशान होके we are doing things. So please surrender yourself to the nature, to the doctor. Your doctor will know what is best for you. Now, coming to postpartum depression. Now, postpartum depression is real. It is not something which a mother does herself. And actually, postpartum depression is a spectrum. It starts with what is known as baby blues. Baby blues is that you're constantly tired, there's some fatigue, you're not in your best mood, there is a lot of anxiety, fear, whether I'm doing things right or not, you can't sleep, plus the demands of looking after a newborn. So it's not an easy phase. And they say almost 50 to 70% women face some kind of postpartum blues, which is normal, right? But when the situation goes little more severe, we say that it is postpartum depression. Now, postpartum depression, all these symptoms become more severe, that, you're constantly worried, scared, very anxious, you have depressive thoughts, you may not be wanting to look after yourself, look after the baby. You may even want to harm the baby. So this is a serious thing. Now, this requires, treatment by a gynecologist and a psychiatrist. The third spectrum, the third part of the spectrum is postpartum psychosis. Psychosis is woman has gone into a state where she's having delusions, hallucinations. She cannot be trusted alone to be with the baby. She might want to harm herself. She might want to harm the baby. Now, this is a psychiatric emergency which needs hospitalization. So why does all this happen? Is one, of course, suddenly there has been a sudden drop in the levels of the hormones. The estrogen comes, the progesterone comes down. So this somehow interferes with the neurochemistry at the level of the brain. Then, of course, we need to understand that bringing up a baby is no joke. In olden times, they used to say it takes a village to bring up a baby. But today, there is no village. The poor woman is all alone. The parents might come there for 10 days or 15 days, Then she's also worried, oh, after 3 months or 6 months, my maternity leave is finishing. How do I make sure that I'm fit? How do I get the right nanny? How do I make sure? So there's so much which is happening in her mind. So the cortisol levels are high. So, this is a time when she needs the support. So I tell this to all the moms, never ever try and be the best mom or the perfect mom, because this entity never exists. Whatever you might do, it may not be the best or the perfect. So take only as much as you can. So ask for help. Ask your husband or partner, your friends or relatives. Remember, it takes a village to bring up the baby. And if you are trying to do it all alone, you are naturally causing a lot of stress for yourself. So ask for help. And in case the situation is not improving, of course, we have treatments where we can give anxiolytics, we can give, antidepressants, a lot of medical things are there. Make sure that your diet is good, your iron levels are good, you're taking good supplements which your doctor has given you after you've delivered the baby.
So, doctor, I would like to discuss the menopausal phase for a woman. Uh, there's a lot of awareness about perimenopause these days. Almost like there are people who are actually telling on Instagram, the so-called influencers and health influencers, that if you are 35, either you're already menopausing or you are in a perimenopausal stage. Is that true? And if it is so, that a perimenopause is also a phase of life, then how do you get to know that you're in a perimenopausal stage, and what do you do to alleviate the symptoms?
Hmm. So, first of all, most important request to everyone who's watching, follow the real health influencers, not just the influencer, somebody who is an expert, who knows the stuff, who is a doctor, who is probably a expert in this field. Don't just follow. I don't agree with this term health influencer. भाई डॉक्टर से पूछ लो ना, या डॉक्टर को फॉलो कर लो. That's most important. Follow a credible source of information. That's very important, because most of the times we as doctors are struggling to clear the misinformations. Then coming to the main point, menopause and premenopause and postmenopause. So let's understand what is menopause. So menopause means menses pause. When the periods pause, it's menopause. When the periods do not come for 1 year, this is known as menopause. Now, typically 4 or 5 years before the actual onset of the complete menopause, the periods tend to become irregular. They may be early or late, scanty or heavy, whatever. This is known as premenopause or perimenopause. Nothing needs to be done for this. So you don't have to get paranoid, oh, मुझे premenopause हो रहा है या perimenopause हो रहा है या क्या हो रहा है. In case you get symptoms like irregular periods, or you get some issues like acne, hair growth, weight gain, whatever, go to a doctor first. Get yourself investigated. It could be simply a PCOS or a thyroid issue, and you're just saying, oh, I'm having menopause. So don't just conclude just because somebody on the Instagram is saying that you are 35 and now you may be into a pre or a perimenopause. So most important is get yourself properly investigated. Once you've gone into menopause, complete menopause, then also there is nothing to worry. And I tell this to people that please don't worry about menopause. Nobody dies because of menopause. In fact, if you look after yourself well, this can be one of the most fruitful and most gratifying and most, I would say, authentic phases of your life. I have seen the best part of my life after my menopause. And in no way, it's been actually very liberating for me. Oh, periods nahi hai. Now I can go hike, trek, swim, do whatever I want to. So let's first understand that there is nothing to get scared of menopause. Like puberty, menopause also is a natural phase of life. Someday it will happen. It has to happen. Let's accept this with a lot of gratitude in our mind and lives that we have come this far. We've been so healthy, we've raised a family, we've done so well professionally. Isn't it something which we should be proud of, rather than, getting worried, oh, I've become menopausal, now something will happen, bad will happen to me. No, it's not like that. Of course, there are a lot of changes which might happen, which is a natural part of aging. We all are supposed to get, age as we, grow in our lifespan, and we should not be getting worried about it. Karna kya hai? This is something which people must know. You know, make sure that you eat healthy, make sure that you exercise, make sure that you have some me time, you do something for yourself. Make sure that you go to a doctor, get the right supplements. So please don't worry about menopause. I know today every damn person is taking on to the opportunity of talking menopause because this is the new in thing on the Instagram. So that's not fair. And I truly believe in this. So, like I said, when you do not get a period for 1 year, you go into a complete menopause. So, we need to understand that every woman is born with a fixed number of eggs in her ovary. Now, men continue to produce sperms while women don't make new eggs. So, we are born with a complete supply of eggs right from the beginning. Now, when your eggs finish, you go into menopause. For someone, if the number of eggs is more, she might have a late menopause. While someone who has lesser number of eggs, usually this is genetically determined. That's why it runs in family. Supposing if your mother had an early menopause, probably you might also have an early menopause. So it is your egg reserve which decides when you would have your menopause. And of course, we spoke about it, why in today's modern situation, because of pollution, bad diets, herbicides, pesticides, alcoholism, smoking, women are losing their eggs much faster than what nature wanted this to happen. So typically we say the average age for menopause should be more than 45. In case somebody gets a menopause between 40 to 45, this is called early menopause. I would say about 5 to 10% women go into early menopause. In case a woman gets a menopause before 40, this is known as premature menopause. About 1% women may go into an early menopause, but today we are seeing more and more number of women going into premature menopause also.
We know for a fact that the bone density reduces post menopause.
Yeah.
What are those things that you tell your patients, especially when they've either gone through menopause or just about to hit the menopause, to be very sure of, to be included in the diet? What kind of a lifestyle do you encourage them to have so that they stay healthy and their bones and joints actually stay healthy?
So let's just talk about what are the problems which women may face because of menopause.
Yeah.
So she may have irregular periods. She may have trouble losing weight. She may gain weight. The skin and the hair don't look that good or lustrous as they used to be. The biggest, and of course, a lot of women face what are known as hot flashes or night sweats. So what are hot flashes is they suddenly feel that there's a sudden burst of heat which usually involves the upper part of the body, the face, neck, and the chest. So suddenly this becomes very red, flushed, and this is followed by a lot of sweating. So you feel completely drenched into the sweat. So what are hot flashes? So hot flashes are basically sudden bursts of heat and warmth and redness, which typically involves the upper part of the body, the face, neck, and the chest. And this is typically followed by a lot of sweating, so much so the person may actually be completely drenched into the sweat and may have a lot of feeling of an absolute fatigue after that. So this disturbs many people. Of course, there are certain bigger dangers of menopause in case they are not taken care of. So one of the most important thing is osteoporosis and then compromised cardiovascular health. So what is osteoporosis? Is that the bone density tends to come down. So in a simple manner, if I have to explain, आपकी bones खोखली हो जाती हैं. They become very, they are not as dense as they used to be, because estrogen is something which builds the bone. So now, when there is no estrogen, so what are you supposed to do? So make sure, once again, that you exercise and do what is known as strength training. Make sure that you develop good muscles in your body. Make sure, when you work with weights, when you work against good resistance, then the bones, they tend to, there is a lot of osteoblastic activity which happens in the body. So make sure that you exercise a lot, do strength training, do a lot of body weight exercises, and of course make sure that you are not overweight, so that there's not enough a lot of pressure on your joints also. And all these things will actually help in improving your cardiovascular health also. Then there's less pressure on your heart also. And make sure that you take the right supplements. So in menopause, this is important, that you must take things like calcium, magnesium, vitamin D, your omegas, prebiotics, probiotics, vitamin B. So these are things which you must definitely talk to the doctor and start taking good supplements. Of course, there's something known as soy also. So soy is a good source of plant-based, uh, you know, estrogens. These are known as isoflavones. So try and include those things also in your diet. And make sure that you get some me time. अपने लिए टाइम निकालना है कि आप टाइम से सो रहे हैं, अपने लिए अच्छी डाइट ले रहे हैं, एक्सरसाइज कर रहे हैं, do something which makes you happy, makes you feel relaxed. You've done so much for your family, for everyone else. Now is the time to start doing things for yourself.
There's also a lot of conversations on modern day uh, aids and techniques to ease out the menopausal journey, like HRTs. What is an HRT and when should a woman go through an HRT?
So first, let's understand what is HRT. So HRT stands for hormone replacement therapy. So now what is deficient in your body? We are trying to replace it from outside. So we try and replace it with estrogen and progesterone. Now there are two types of HRT. Supposing somebody has undergone removal of uterus. Now that person needs only estrogen. She doesn't need a progesterone. While in case the uterus is intact, now she needs a progesterone also along with estrogen to counteract the effect of estrogen on the endometrium. This is a little technical, but the doctor can suggest you what type of HRT is good for you. Now, who needs HRT? So now we have standard guidelines for HRT. So they say in case a woman is less than 60 years of age and HRT started within 10 years of menopause, there is a lot of benefit in using the HRT. So HRT, of course, comes with its own risk also. Not everyone can use an HRT. So there are indications for that. There are contraindications for that, that who must use HRT and what type of HRT should be given. But according to most of the scientific guidelines, in case a woman is less than 60 and in case the HRT is started within 10 years of menopause, the benefits outweigh any risks. Of course, who is the person who is a bad candidate for HRT? Somebody who is a smoker, somebody who has a history of estrogen dependent cancers like breast cancers, ovarian cancers, endometrial cancers, somebody who has a history of deep vein thrombosis, gallstones, gallbladder stones, history of depression and mental issues. So these are the, places where we have to think before starting HRT. So once again, remember, HRT is not for everyone, but HRT holds a good place in case somebody is having bad osteoporosis, she's having bad hot flashes and she's very uncomfortable, her quality of life has gone bad. Of course, there's definite merit to starting HRT.
So we'll talk about a few terms that we use very commonly these days, especially with women and their health or gynecological health. And I just want to understand your view
Hmm.
on these.
Yeah.
So while I was growing up, and maybe I was working, is when the HPV vaccine came in.
Hmm.
There was a lot of newness about the vaccine. People were still not very open about trying it, but there is a certain age by which girls should go through the HPV vaccine. So, what is your take on the HPV vaccine?
100% recommended. Every woman, every girl, child must be given a HPV vaccine. But today, CDC guidelines actually recommend that even boys must be given a HPV vaccine. So it's a gender neutral vaccine. So let's talk about what is an HPV vaccine. So HPV vaccine works against a virus called human papilloma virus. Now this human papilloma virus is the reason behind the cervical cancers, vaginal cancers, anal cancers, penile cancers, throat cancers, head and neck cancers. So even men are, uh, you know, uh, because they have anus, because they have penis, because they
Yep.
are exposed to the same risk of head and neck cancers and throat cancers. So today CDC guidelines says that men and women, boys and girls both, from the age of 9 years onwards, must be given an HPV vaccine. And till about 15 years, only 2 doses are given, 0 and 6 months. And after that, 3 doses are required. So 0, 2, and 6 months. And the best time to take the vaccine is between 9 to 26 years. After 26 years, it is called rescue vaccine. 26 to 45 is a rescue vaccine. Post 45, they say that there is not much benefit if you take a HPV vaccine. So HPV vaccine is recommended highly for both the sexes.
So you're saying that if somebody is still in their 40s and has not taken HPV vaccine, it's not too late. They should actually go for an HPV.
40s is actually quite late, but please think before that.
Yeah.
I mean, there is so much of now information about HPV vaccine. I think it's been in market now for more than 25 years. I mean, in a proper, in a regular market. So I'm sure, you would have heard about it. If not, please get yourself educated on that, and please take the HPV vaccine. And for all the women, it's not just the HPV vaccine. You must keep getting your pap smears also regularly. So we say from 21 years of age onwards, a woman must get every 3 yearly a pap smear. In case you're getting an HPV testing along with the pap smear, it is every 5 years. So it's not such a big thing. I mean, you definitely can get a test done every 3 years or 5 years.
In addition to this, since you're talking about pap smear, in addition to this, is there any other test apart from a mammograph post a certain age, let's say 40 years of age? Is there any other test that you suggest to women in their 30s to take?
So there are a whole lot of tests, the complete blood count, thyroid, kidney function, LFT, ultrasound, pap smears, mammogram. So once again, the entire health investigations should be packaged by your doctor, because your doctor would know what is your history. Your doctor would know if somebody in your family has a breast cancer, or what is your sexual history, when should we start doing pap smears for you, what are the tests which we should be blood tests which we should be doing. So don't just randomly order a lab guy, okay, come and take my test. Please visit a doctor.
Yeah.
The doctor probably would, in all probability, save your money only.
Doctor, for a lot of menstrual hygiene products, there's a change. Like we used to use pads at some point in time. People used to use cottons and cloth, and today there are many new age products like tampons and cups. What are these products, and how hygienic are they to actually be used every month during the menstrual cycle?
So we need to understand the basic difference between all these products. So when you use a pad, the pad is soaking the blood which is coming from the vagina. Now, the tampon is made up of pretty much the same, stuff which the pad is made up of. The only difference is that the tampon goes inside the vagina. So the mere inconvenience of putting a pad outside is not there with the tampon. So tampons are actually pretty convenient. It's just that some women are not very comfortable putting something in their vagina. But in case you are comfortable, this is actually a very good thing. It's just that you should know that every 3-4 hours you must remove it, change it, never go beyond 8 hours, and never forget a tampon inside. Tampons are actually very, very convenient in case you want to, go for swimming or any such kind of a sport where pads might be inconvenient. Tampons are a very great option. Then we have menstrual cups. So the difference between a menstrual cup and a pad or a tampon is that menstrual cup collects the blood while they soak the blood. So a menstrual cup is inserted into the vagina where it collects the blood. So at regular intervals, typically every 4 or 5 hours, you just need to remove the cup, drain it, wash it, and again reinsert it. Right? And the biggest advantage with a menstrual cup is that there is no recurring cost.
Yeah.
There is no cost of a pad or a tampon. It is environmentally so good for the environment. The pads and tampons, they take years in a landfill to get completely disintegrated into the system. It might take up to 400 to 500 years for a pad to be completely disintegrated into the environment. So that way, it is environmentally more conscious decision. It is more cost effective. It is just that some women don't like to put a cup inside. But in case you've got a hang of it and you're comfortable with this, there's actually no harm in using a cup.
So, what is the best method for using a contraceptive? Is it a pill? Is it something else? And when should women use it? When should they not use it? And when should they stop using it for together?
So the best contraceptive method does not exist.
Okay.
जिस दिन कोई बेस्ट कॉन्ट्रासेप्टिव एजेंट किसी ने निकाल दिया ना उसको डबल ट्रिपल नोबेल प्राइज मिल जाएगा. So we as doctors decide what is best for that particular patient. Whether it is a simple barrier method, which could be a male condom or a female condom, or a birth control pill, or using an IUD, or a DMPA, or a sterilization. There are various kinds of methods which are available. And like I said, we decide what is best for that couple depending upon their medical history. So never ever start a pill because your friend was taking. Oh, my friend or my sister was taking this, so I am taking this. That's a bad idea to do that. So in case you're planning to get on a pill, number one, it's one of the very great contraceptive methods. Worldwide, millions of women take a contraceptive pill, and contraceptive pill has actually revolutionized the entire reproductive destiny of a woman. Imagine the control of her destiny is now in her hand rather than waiting for her husband to use a condom. So the entire control on when I want to become pregnant, how many children I want to have is entirely my choice. So it has actually placed the control of her destiny in her own hand. Now coming to medical part of it. Are birth control safe? Absolutely safe. I'm again saying this on camera. Birth control pills are absolutely safe to use provided your doctor has written that prescription for you, because your doctor knows what is good for you and what is not good for you. Depending upon your history, the doctor would tell you which birth control pill. We have today more than 100 types of birth control pills, and depending upon a particular person's situation, we would know what kind of a pill is good for that patient. And of course, the pill needs to be taken in a proper manner. It's not like that you can just pop in a pill and then that's the end of the story. There's a proper way how a birth control pill must be taken. So if you adhere to that that plan of taking a pill, it is one of the most effective methods of contraception. The failure rate of using a pill is actually 0.01%. If we compare it with a condom, they carry a failure rate of 4 to 8%. So it's 400 times more effective than a condom. So using a pill is a great idea, provided it has been given to you by your doctor, and adhere to whatever schedule or the protocol has been given to you by your doctor. And pills, by the way, are used for a lot of non-contraceptive benefits also. Like today, pills are used for treating your periods, pain, heavy flow, PCOS, endometriosis. We need to understand, when we use a pill for treating your PCOS or endometriosis, we are only taking care of your symptoms. We spoke about it, how a PCOS should be treated or how an endometriosis should be treated. That's a separate story. But PCOS and endometriosis can be managed by using a pill also. And once again, you know, it should be taken after doctor's advice only, because there are small subset of women where pills cannot be used. For example, somebody who's a smoker, somebody who has a history of estrogen dependent, cancers like breast cancers, endometrial cancer, somebody who has history of DVT. These are not the good candidates for uh, pill. So never ever take a pill just because your friend or sister gave you a pill. Okay, you should take this. No, never like that.
So, Doctor, to just conclude our podcast, I have a section towards the myth and facts today. You cannot get pregnant during your period.
Myth. You can.
Birth control pills cause long term infertility.
Absolute myth.
Intimate washes are necessary.
Myth.
Contraceptive pills can cause cancer.
No, absolutely a myth.
Withdrawal method is very effective birth control method.
Myth.
Any older woman can get breast cancer.
Myth. The breast cancer can happen in a younger woman also.
Fertility ends at 35, full stop.
Myth.
Birth control pills always cause weight gain.
Not really. Some may and some may not.
So, Dr. Anjali, you started Maitri 4 years back.
Yeah.
Right. And it has touched more than 1 million women so far. I think a lot of women who probably not even open to come up with questions related to their health have found solutions looking at your videos.
Yeah.
So, do you want to share more about it?
Yeah. So, Maitri is very dear to my heart, and I wanted to create a space where women have access to scientific, latest, evidence backed information in a non judgmental manner. So we created Maitri, and I was amazed myself that within 3 months we had 1 lakh subscribers. Within 1 year we had 500,000 people, and today we have close to 1 million people across the globe who follow us. I mean, precisely, people in 48 countries follow Maitri, and recently we got verified by WHO as Maitri is a voice which you can trust. So we've really put our heart and soul into it. And anytime you have any, issue and any, question, so you can always visit our channel. It's called Maitri. So the name suggests that Maitri is going to be your friend and guide in all the matters pertaining to your health. So in all probability, if you type a question, you will find an answer on Maitri, and you can follow us on our Instagram also. And we are coming out with our India's first chatbot on women's health. This is called Aisha. This will be WhatsApp based, so you can have a companion on your phone, and you can 24/7 ask any question related to your gynecological or reproductive health. So we are, doing a lot of things at Maitri and Aisha. So please do follow us there for a lot of trusted medical content.
Thank you, Dr. Anjali, for coming over on our podcast and giving us your valuable time. I'm sure our audiences have much more to ask from you, but thanks a lot.
So thank you very much, Neha, for inviting me. And I hope I've added some value to the podcast. And thank you very much once again. It was my pleasure and my privilege to be on your show.
Thank you. So thank you for watching our podcast today. For more such content, please subscribe to our channel on YouTube and follow our Instagram page, HK Vitals.